I'm going to hand you all a 3x5 index card. You're going to hold on to it for later. Some of you in the audience have already heard this discussion at the Jim Jeffries show, downtown Cleveland at Playhouse Square. But when I was faced with coming up with a persuasive speech, my friend Ryan suggested that I cover circumcision, because I'm very passionate about it. I decided that this topic is a worthy topic. It makes many people uncomfortable. It's often shrouded in secrecy and shame, as well as guilt. But I believe it's an important topic, worthy of us all being slightly uncomfortable for. So my speech this evening is When Medical Procedures Become Obsolete. I'm Jackie, and welcome. Gloria Steinem says, whenever one person stands up and says, wait a minute, this is wrong, it helps other people to do the same. Medical procedures have been performed throughout history. That as new information becomes available, the procedures themselves become obsolete. I have a picture of the original invention of the chainsaw in 1780. It was used for symphyotomies and pubiotomies, which was the act of sawing the pubic bone to allow for vaginal delivery of babies. They were performed throughout Europe and parts of America until the 1980s. It was not until 1987 that the American Academy of Pediatrics formally declared it unethical to not operate on newborns without anesthetics. Circumcision was a tool used to curb masturbation as well as solving a host of other medical issues in the late 1800s in the United States. John Harvey Kellogg, the inventor of Kellogg's cereal, wrote in his book, Treatment for Self-Abuse and Its Effects, Plain Facts for Old and Young, in 1988, a remedy for masturbation, which is almost always successful in small boys, is circumcision. The operation should be performed by a surgeon without administering an anesthetic, as the pain attending the operation will have a salutary effect upon the mind, especially if it be connected with the idea of punishment. In the same writing, he went on to discuss the female counterpart to circumcision, which at the time was applying carbolic acid to the clitoris of young girls. We no longer argue for that. We should not be arguing for male circumcision. Around the same time, there was a doctor named Louis Sayre, and he touted circumcision as a cure for a variety of issues. I've included them here, as gout, asthma, hernias, epilepsy, rheumatism, curvature of the spine, tuberculosis, and elephantitis. I don't know about you, but I don't think circumcision cures tuberculosis. There are many common reasons given to argue for circumcision. One of those reasons is a reduction in cancer. Although it is true that cancer cannot be had in foreskin that has been removed, it's due to the fact that it's removed. It's not the act itself that cures cancer. Another reason people argue for circumcision is a reduced risk in urinary tract infections. Antibiotics are often given to treat urinary tract infections. In my own personal experience, my daughters have both had urinary tract infections that were easily treatable. My intact son has had none. Another reason given is hygiene. Many people believe that the foreskin itself is a harbor of bacteria and it's dirty. I would argue if that were the case, then we would see every other male mammal on the face of the planet without opposable thumbs and access to soap and water with infected penises. That's not the case. One last reason I have included that people argue for circumcision is they believe that there is a reduced risk in sexually transmitted infections. I would argue that if a circumcised man is unwilling to have unprotected sex with someone who is infected, that circumcision is not an argument to reduce sexually transmitted infections. Condoms is still the safest way to prevent sexually transmitted infections. There are many reasons to wait. As I stated earlier, prior to 1987, pain relief was not given to infants. And to this day, Although there are numbing agents that are given prior to and during the procedure, there is limited pain relief after. You can have Tylenol. I don't know about you, but I feel like genital cutting is not really reduced with Tylenol. There are many bonding and breastfeeding issues that come with circumcision. Circumcision is often done within the first 3 days of life. That's the most critical time for a baby to bond with its mother. And if it's dealing with pain and discomfort, it's going to affect those bonding and breastfeeding issues. If a reduced risk of infection is one of the reasons to argue for circumcision, then I would argue that having an open wound in a diaper that is a moist environment, coming in contact with urine and feces, is a recipe for an infection. There are many bleeding issues that happen with circumcision. Babies do not start to produce their own vitamin K until day 8 after birth. If a baby has clotting disorders, a circumcision could affect those. The last reason that I will give is hypospadias. The Centers for Disease Control reports that 1 in every 200 babies are infected with hypospadias every year. Hypospadias is a condition where the urethra opening on the penis is not on the head of the penis. It can be all along the shaft in varying degrees. When that's the case, in order to have surgery to repair that, skin needs to be present. If there is no foreskin to be used to correct this issue, it's going to have to be harvested from some other part of the body. Usually it's the thighs. I've included a graph of infant versus adult circumcision. There are many reasons that one should wait to perform circumcision. One of those reasons is there's no informed consent from the owner of the penis when it's done on an infant. And circumcisions kill over 100 males every year in the United States. And right now, those are baby boys. Maya Angelou says, "I did then what I knew how to do. Now that I know better, I do better." I hope you continue investigating this information. It's worthy of your investment. Many of the websites that I've included can be savingsons.org, drmama.org, bloodstainedmen.com, intactamerica.org, and there's a very fantastic video on YouTube called Circumcision, an Elephant in the Hospital. Thank you for attending this evening. Do you have any questions?
Yes, I do. Is this circumcision reversible?
It's not reversible per se, but there are many things that are on the market now that kind of aid in restoring the foreskin. There are various weights that can be added to try and restore the foreskin, if you will. Any other questions?
What percentage of men are circumcised in the world?
I'm glad that you asked that. America stands alone as one of the only countries who still routinely performs infant circumcision on boys. As of right now, the rates worldwide are about 36 to 39%. As more people are becoming aware of this, those rates are reducing. Right now, it's majority Muslim countries and the United States who performs those circumcisions. Any other questions? From the one who's sleeping over there? No? Okay.